everyone. Welcome to today's Pet Pawcast. I'm your host, Dr. Roberta Westbrook, and you're here with us at the Campus for All Animals, the Houston SPCA, and we're so happy to have you. It's a wonderful holiday season, and one thing about the holiday season is a weather change, and for a lot of us, we love this cold weather and this weather change. But it does bring on some health concerns for not only ourselves, but for our pets as well. Oftentimes when the weather changes, we look for increases in things like respiratory disease. And so today we're going to talk about how to recognize if your pet has respiratory disease, like a cold, and what to do about it. So we'll give you some tips and tricks. So if you have any questions, please let us know and hopefully I can help you. Until that time, I do want to introduce you to our pet of the week this week, who is Bear, an adorable dog who is a 1-year-old male lab. He is neutered, and he's a mix. We think he's Labrador and maybe Retriever mix. So he'll make hopefully a wonderful family pet. He's very sweet, cuddly, and the most important thing about Bear is that he has been sponsored by Tia and Cameron Johnston, the punter for the Houston Texans, and his adoption fee has been covered. So we just want to say, if you are interested in meeting Bear, please come on down to our adoption center, meet with him, and see if he would make a wonderful addition to your family. And his adoption fees have been covered. So we're happy to have Bear as our pet of the week this week. So let's talk about colds and respiratory disease in your pets during this holiday season.
All right, so do dogs get cold?
Yes, so that's a great question. Number one, do dogs get physically cold? They can. So when the winter comes, they can get cold physically just like we do. They do have this nice fur coat that helps to protect them and helps them to regulate their body heat. But extreme changes in the weather and the temperature around them in their environment can certainly lead them to be more susceptible to health issues, like being susceptible to bacteria and viruses that might lead to what we know as colds or respiratory disease. So yes, animals can get physically cold. Changes in that body temperature can affect their immune system, and they may be more likely to become ill.
And what are the most common infections that we see with these that have the same symptoms?
Right. So when we talk about animals having a respiratory disease, particularly in dogs, what you will hear us say is that your dog may have kennel cough. It's a very common general term that's referring to a set of respiratory symptoms. Kennel cough is a broad term. It's important that I mention to you that kennel cough is a broad term that indicates respiratory disease, but there are many, many causes of kennel cough in terms of bacteria and viruses that cause kennel cough. And we may not always know which bacteria and which virus are leading to kennel cough. Now, kennel cough is a type of respiratory syndrome that leads to a couple of symptoms that you may notice in your dog. Kennel cough leads to, just like the name states, a cough. So oftentimes dogs that have kennel cough have a dry, hacking cough. Most of the time, they are still active, alert, they still eat, they still drink, they still are able to enjoy life. But there are some cases of kennel cough, depending on the type of bacteria or virus that causes it. There are some cases of kennel cough where the symptoms are more severe. So maybe there's a cough, maybe there's sneezing, there may be nasal discharge, there may be ocular discharge, and your dog could be lethargic and not feel very well or have a fever. Those are symptoms of kennel cough that are more severe than others. But again, it just depends on which bacteria or which virus is causing the kennel cough.
And so what other, are they other illnesses that you mentioned? How are they different?
Yes, so depending on the cause of the kennel cough, the bacteria or virus depends on the severity of the symptoms. And as I mentioned earlier, we may not know which bacteria or virus is causing these symptoms. The way that your veterinarian is going to know is by running a test. Now, it's not always necessary to run this test, but if we want to know the specific cause of the respiratory disease, we can culture your pet's respiratory tract. Oftentimes what this means is the veterinarian can take a sterile cotton swab, and we can put that cotton swab in the back of the throat or in the nose, and we can send that swab to a lab, and they can culture the either bacteria or virus that might be on that swab, and it can tell us what is the cause of the kennel cough. And there's, again, multiple different causes. Some of the causes might be Bordetella, like you may have heard of, or distemper, or canine influenza, or canine reovirus. There's lots of different respiratory viruses out there, and so it could just depend on which bacteria or virus that your pet has.
And all these symptoms, when should we take the pet to the vet? Or like, it's a simple cough, should we just monitor it?
Yes, so if you're noticing these symptoms in your pet, always take your pet to the veterinarian, because coughing can be a symptom of a cold, like kennel cough, but it could also be a symptom of other more serious conditions. And so we definitely want to make sure that if your pet develops any new symptoms, coughing or sneezing, that you have that evaluated and get the proper diagnosis. We don't want you to just assume it's kennel cough. We want to make sure that that's what it is. Now, kennel cough in general has a really good prognosis. With proper treatment and veterinary care, most dogs will recover from their respiratory disease. Most of the pathogens or the bacteria and virus that cause respiratory disease are pretty mild. They typically run their course in about 10 to 14 days, and oftentimes pets get better. There are certainly some more serious life-threatening viruses like canine distemper that sometimes pets can pass away from, that it could be fatal in some cases. There are some types of bacteria that also can be fatal in some cases. So it's important to get your pet to the veterinarian so that they can get treatment right away.
And can these type of diseases or illnesses be spread to other dogs or even other kids or humans?
You know, so answer to the first question, can these bacteria and viruses be spread to other dogs? Absolutely, which is how it spreads oftentimes during the winter, because during the winters, oftentimes families are traveling. And when families are traveling, they may consider boarding their dog at a boarding facility. That's why it's important that before you board your dog at a boarding facility, that you have all of your pets' vaccinations up to date. And that way, all of the pets in the boarding facility have the best immune protection that they can against bacteria and viruses. But being in close contact with each other, absolutely, through sneezing, through respiratory secretions, those bacteria and viruses can be spread to other dogs. Now, most of the time, it's not very common for these diseases to spread from dogs to people. There are some bacteria, particularly in immune suppressed persons, there are some bacteria that can affect human beings as well. Again, not very common, pretty rare, and may only happen in persons who are immunosuppressed. Viruses tend to be very species specific, and so we're not likely to see canine specific viruses affect people or vice versa.
So how do we prevent it from other dogs, especially in the household, getting infected?
Right. How do you protect all of the dogs in the household from getting infected with a respiratory virus or bacteria? The main way is to make sure that your pet is vaccinated. So vaccines are going to be the best way that you can really teach your pet's immune system what foreign bacteria and viruses are dangerous and how to fight them off. So please see your family veterinarian. Make sure you're up to date on your vaccines, especially if you're going to be boarding your pet during the holiday season.
And then which vaccines in particular should we make sure that they have?
So please make sure that your pet is vaccinated against Bordetella. So Bordetella is probably one of the more common bacteria that cause kennel cough. There's another one called parainfluenza, which is different than canine influenza. So there's Bordetella, there's parainfluenza, and there's one that we vaccinate for called adenovirus. So between Bordetella, parainfluenza, adenovirus, and canine influenza, those are going to be the vaccines that you need. Your veterinarian can certainly help you go through those vaccines and figure out which ones your pet has had in the past and needs to get. And the good news is that at least 3 of those come in one vaccine. So your pet does not have to get multiple shots or have multiple types of vaccines entered into the nose or the mouth. Those can be combined in most cases, and it may only require 1 shot, or some of these vaccines come in the form of an intranasal form or an oral form. So it depends on your family veterinarian, what product they have available, and the best product for your pet.
So how do we treat a pet with a cold, for lack of better words?
Yes. So what do we do if your pet has a cold? And again, a lot of it depends on the severity of the clinical signs, because in some cases when the clinical signs are very mild and maybe your pet is still, again, eating and drinking and active and doesn't have a fever, sometimes no treatment is okay, just supportive care, making sure that they are healthy, eating well, taking rest, and this can just run its course in about 10 to 14 days. Now, as the symptoms get more severe, sometimes there's nasal discharge, ocular discharge, or your pet is lethargic or has a fever. Your veterinarian may prescribe drugs to help with these symptoms and to clear up this infection. That could be antibiotics. In some cases, it can mean antiviral medication. It can mean eye ointment or even nasal spray. So it really just depends on the symptoms, but it's supportive care and it's allowing the bacteria and the virus to sort of take its course. But again, in most cases, pets will get better in about 10 to 14 days. Again, there are a few very serious bacteria and viruses that can cause pets to be sick for a little bit longer. And those are going to be like canine distemper or mycoplasma, some of the more serious bacteria and viruses there.
Can like a steam shower, humidifier help my dog that's congested with a cough?
Yeah, that's very interesting. So some of you may notice that when you are congested, you have nasal congestion. When you get into your shower, usually you can breathe much better. You notice that your nasal airways open up, that you feel better, that the drainage happens. In the same way, sometimes we recommend that if you're noticing your dog or cat, for that matter, has nasal congestion, sometimes putting them in the bathroom while you are taking a shower can give them those same benefits. As the steam fills the room, that steam enters the airway, the nasal passages, and it helps to open them up, and it can give them some temporary relief from the congestion. When they're outside of that steamy room, the congestion is likely to come back, but it can provide some temporary relief. And we do that fairly frequently with cats who are congested.
So yeah, that's my next question. What type of kind of diseases do cats usually see? Do they get kennel cough as well?
Right, so cats absolutely can get respiratory diseases. And so in cats, we usually just refer to it as upper respiratory infection in cats. But cats can get bacteria like Bordetella, where they can cough as well. And we typically don't use the term kennel cough for cats, but they absolutely get a respiratory disease. And sometimes the bacteria that affect dogs can sometimes affect cats as well. So it's important to keep your cats vaccinated. It's more common in cats for them to have a virus. So when cats have respiratory disease, they're sneezing, they're congested, they have nasal discharge or ocular discharge, it is more often a virus in cats. The 2 most common viruses are called herpes virus and calicivirus. And so those cause respiratory symptoms. And in some cats, it can be severe where they get ulcers in the eye, where their eye can actually become very ulcerated and painful. And in some severe cases as well, it'll cause ulcers in the mouth, and even ulcers on the paw pads. So there are some cases of respiratory disease in cats that can be more severe than the typical just sneezing. So, it's cold, the weather is getting cooler. Just make sure that your pets are protected by making sure that they get vaccinations and that they're seeing their veterinarian regularly. We want you all to have a wonderful, healthy holiday season. Now, we've got an exciting time coming up. So for our 35th anniversary, of our partnership with Neiman Marcus, this is our 35th anniversary, we are doing an adoption event at Neiman Marcus in the Galleria. This annual adoption event goes from Black Friday, the day after Thanksgiving, all the way to December 23rd. And we are going to be there every Friday, Saturday, and Sunday for adoptions. You can come on down, take a look at the puppies and kittens that we have available for adoption. Go to Neiman Marcus and they'll be on display in the windows. Monday through Thursday from Black Friday to December 23rd, you can learn more about the Houston SPCA, all of our programs, and everything that we're doing to help pets in our community by visiting with some of our staff and learning more about the organization and hopefully becoming a part of our larger extended family and supporters. So we encourage you to visit Neiman Marcus in the Galleria between now and December 23rd, and let's make a partnership, and we'd love to meet you and have you a part of our family here at the Houston SPCA. And if you need assistance for your new puppy or kitten, our pet wellness clinic is also open Thursday through Sunday, and we would be happy to be your pet's veterinarian for the future. So we thank you for joining us here on the Pet Podcast, and we will see you next week. Happy holidays, everyone.